wound healing is rather short, simple, and to the point, so I've added on additional couple of things that sort of segue into it, so it'll be helpful. So the epidermal wound, if you get an ouchies, then you get rid of the first portion of your skin, the epidermis, the uppermost portion. What's going to happen is that basal cells, remember the part that likes to divide, is going to continue to divide and then migrate those, rather than push them up as much, they're going to start going that away. They're going to start migrating. And as soon as they all combine together, then they're going to start pushing out. They're going to form a stratum spinosum, a stratum granulosum, lucidum if it applies, and then cutaneous. If you got a major O that goes below the epidermis, and then to the cutaneous or the subcutaneous or the hypodermis, what will happen is that scab will form. We won't get into huge detail about it, but that scab it does help you from bleeding, stop you from bleeding. But you also still have quite a bit of blood and that stuff hanging out, so don't pick that scab. Now, what will happen is that stratum basal will start migrating over, and these other macrophages, these other tissues are going to start replicating and trying to take over the scab tissue. After a couple of weeks, that stratum basal has taken over, it's cut off that portion of the scab, and it's started to migrate upward, slowly sloughing off that scab until finally you have that cutaneous layer built and it just starts shedding off, and that scab is eventually also going to just slide right on off as well. Now, here's the problem. If you're always stimulating things to grow, say, I don't know, skin is always growing, you're going to have more of a chance to expose it to ultraviolet light. You're also going to have more of a chance to make mistakes when you're doing replication and all that stuff. So it's sometimes the skin cancer kind of happens. It just kind of happens. And there's three major types. So you got a normal nevus, which is just a fancy way of saying mole. Then you got the squamous cell carcinoma, the basal cell carcinoma, and the malignant melanoma. Which all three of those, they should be like, that's actually kind of easy, because if you look at it really quick, basal cell carcinoma, which layer has something to do with the basal layer? Oh, look at that right there. It's the stratum basal cell carcinoma. Hey, look at that. Oma, by the way, at the end of it usually means that it has some type of cancerous characteristic at the end of it. What about squamous cell carcinoma? Well, that's usually in the spinosum. Kind of makes sense, because you got those guys are just slightly active, they're still going. What about the malignant melanoma? Well, what's melanoma? What's melanocyte? Where is it? Well, yeah, it's in the stratum basal. So it just arises from that stratum basal, the places where these cancers you're noticing are all happening pretty much in the deeper tissue layers of the epidermis. These 5 clues, if you see this problem, if any of these show up on your mole, then please go see a doctor. Go get it cut and find out, get some diagnostics run on it really quick for me. They are the ABCDEs of determining if something is malignant in a malignant melanoma. First off is asymmetry. Is it round? Like this. Benign means, by the way, that it's not going to cause any issues. Or does it not look very round? Look at this. Its edge isn't that pretty. It's not uniformly shaped like compared to these guys. Is the border irregular? Is it odd? Is it notched? Is it bouncing out like a little mountain in its ridges? Is the color changing? You can see the color really good on this one. It's like morphed really different. Lots of different colors. And this one does too. And then you got diameter. Is it smaller than 6 millimeters? This one is definitely not smaller than 6 millimeters. And one big one is it growing bigger? Is it evolving? If any of those 5 characteristics are showing up, please go ahead and take care of that. with that, that is the end of the integumentary system. I do want to point out one last thing, just because I feel like we should, is as you get older, obviously you get wrinkles. You're not producing enough keratin like you usually do, so it's not as strong as it used to be. Nails, again, if you're not producing enough protein, things that are made of protein aren't going to do so hot. So hair, nails, things like that. As well as sweat decreases, which is a huge if you're going to be working geriatrics. If the AC goes out, these patients aren't going to be able to cool themselves as well as just a normal adult. They can overheat a lot more easily. They can also produce something called a pressure ulcer a lot more easily. Often they're referred to as bed sores because these usually appear on people that don't really get to move around in bed or can't move around in bed. So make certain that you try and shift your patient every so often so as to relieve the pressure at those pressure points.